welcome once again to my YouTube channel. And in succession to the videos what I have uploaded on dental histology, I am discussing about the most important multiple choice questions from the NEET MDS exams perspective, which is going to be held in 2024. So the most important rapid fire, this is, I have named it as rapid fire one-liner MCQ series. So beginning with, so students, in this rapid fire series on dental histology, there I have already discussed 10-15 MCQs in the first part of my video. In succession to that video, I am start now the next MCQ, what is very frequently asked. It is about the stages of tooth formation. It is about the stages of tooth formation. So students, do remember, they ask you in the form of multiple choice question. So you must have read about the various stages of tooth formation. So in the various stages of tooth formation, you might be very well aware that it is during the first is the initiation phase or the proliferation phase. The next is the phase of histodifferentiation, and the next after this comes the stage of morphodifferentiation, and next comes the stage of apposition. So in the multiple choice questions, you are very frequently asked about these, that during these stages of tooth development, that is what anomalies are going to occur. If a particular certain anomaly is going to occur during the initiation or the proliferation phase, there is going to arise the supernumerary teeth, the partial anodontia, or the odontoma. So if if any problem, if any abnormality is going to take place during the initiation and the proliferation stages, that can lead to the formation of a supernumerary tooth during the initiation or the proliferation phases. It can lead to the formation of a supernumerary tooth or partial anodontia or odontoma. Next, during the next stage, that is during the stage of histodifferentiation for tooth morphogenesis. So if during the formation, during the laying down, when there is going to occur the histological differentiation, so the most common defects what are seen is that is the amelogenesis imperfecta and the dentinogenesis imperfecta. So students, do remember, during this stages, that is the amelogenesis imperfecta and the dentinogenesis imperfecta is arising because there is defect, there is some kind of an abnormality during the histodifferentiation stage. Next, during if any kind of an anomaly is going to occur during the morphodifferentiation stage. So if there is a defect in the morphodifferentiation, if there is a certain problem during rising during the morphodifferentiation, it leads to the formation of a peg teeth, the mulberry molars, microdontia, macrodontia. So this is going to occur, and the talons cusp. And next, last but not the least, that is during the apposition stage. So during the different stages of tooth development, the histological features, during the apposition stage, if any kind of an abnormality is occurring, that can lead to enamel hypoplasia or interglobular dentine. So students, this was a very short discussion about the various stages, and in the multiple choice questions they are very frequently asking you, that is the enamel hypoplasia, all right, the hypocalcification, the intrinsic staining, and the concrescence. So this is all these defects what are seen in the teeth. It is mainly arising due to the defect, the problem which is occurring in during an abnormal apposition. Now the next important MCQ what they can ask you is about the what leads to the, in what stage there is a defect that leads to dentinogenesis imperfecta or formation of an atypical dentine. So students, do remember, it is during the stage of histodifferentiation. If any kind of an anomaly is occurring during the stage of, if any kind of a problematic or defect is going to be there during the stage of histodifferentiation, so that can lead to dentinogenesis imperfecta or formation of atypical dentine. So dentinogenesis imperfecta, whether it be amelogenesis imperfecta or Formation of atypical dentine, this is all due to any kind of an anomaly or defect during the stage of morphodifference, during the stage of histodifferentiation. I'm sorry. All right. Now, dense in dent and peg shaped. So, dense in denti and the peg shaped teeth, they arise due to a defect or an anomaly during the stage of morphodifferentiation. Now, the next important MCQ, what is very frequently asked, is about the Tomes process. So, what are these Tomes process? They can ask you in the form of 4 options. The Tomes process, they are the projection of ameloblasts into the enamel matrix. Students, do remember the Tomes process, these are the projection of ameloblasts into the enamel matrix. Now, the next important MCQ, what is very frequently asked, is about the Turner's tooth. So, the most commonly involved tooth in Turner's tooth, it is the maxillary anterior, that is the central incisor, and the mandibular second premolar and the mandibular second premolar are the commonest tooth what is affected by the phenomena what is called as the Turner's tooth. So these are the most commonly involved teeth. Now moving on to the next important MCQ, that is about the Hunter-Schriger bands. So students, do remember the Hunter-Schriger bands or the enamel tufts and the enamel lamellae, they ask you about the origin of them. So the Hunter-Schriger bands, the enamel tufts and enamel lamellae are all ectodermal, in origin. The enamel spindle, it is of ectomesenchymal origin. Now moving on to the next important MCQ, the plastic dental tissue. Students, do remember when they ask you which is the plastic dental tissue and elastic dental tissue. So students, do remember the plastic dental tissue. Plastic is a substance which undergoes the least deformation. So the plastic dental tissue, it is the enamel, and the elastic dental tissue, it is called as the dentine. Now the next important MCQ, what they ask is about which in the superficial layer of the older teeth, which of the following elements is seen? So students, do remember nitrogen is found in the superficial enamel layer of older teeth. All right. So which of the following elements is found in the superficial enamel layer of older teeth? It is the nitrogen what is found in the superficial layer of superficial enamel layer of the older teeth. Now, the next important MCQ, what they ask you is about the most numerous cells in pulp is fibroblasts. Do remember, they can give you in multiple options the most numerous cells in the pulp. So, out of the 4 options, you are going to tick the fibroblasts. These are the most numerous cells in the pulp, and the second most numerous cells in the pulp, it is the odontoblast. Now, moving on to the next important MCQ from dental histology. Now, what they ask you, the periodontal ligament is containing what percentage of water? So, students, do remember the periodontal ligament is containing 70% water. Approximately 70% of water the periodontal ligament has. Rankle and rank, they play a major role in bone resorption. They can ask you the genes what are responsible for bone resorption. So the genes what are responsible for bone resorption are, they what play a major role in bone resorption is the rank and the rankle gene they play a major role in bone resorption. The next important multiple choice questions, what they can ask you about the Ordelend bodies. Do remember, students, the uppermost cells of the stratum spinosum, they are called as the Ordelend bodies. They contain the Ordelend bodies. So the uppermost cells of the stratum spinosum, the Ordelend bodies are contained in them. The function of the Ordelend bodies, students, do remember the function of the Ordelend bodies is the retention of fluid. Moving on to the next important MCQ is about the papillae. So mushroom shaped papilla, it is the fungi form papilla which are having a mushroom shape. The most abundant papilla on the surface of the tongue, it is the filiform papilla. Students, do remember, the most abundant papilla, it is the filiform papilla. The mushroom shaped papilla, it is the fungi form papilla. Moving on to the next important MCQ is only papillae which are keratinized. So out of all the 4 papillae, that is the filiform, the fungi form, the circumvallate, see, all of these papilla, out of all these papilla, the only papillae which are keratinized, it is the filiform papilla which is keratinized. Circumvallate papillae, they are partially keratinized. So then next MCQ, they can be asking you, out of the following papillas, which of the papilla are partially keratinized? So it is the circumvallate papillae which are partially keratinized, and the only papillae which don't have any taste bud. Very important, students. The only papillae which do not have any taste bud is called they are the filiform papillae. Only papilla which don't have any taste buds, these are the filiform papilla. Moving on to the next important multiple choice question about the tongue and the papillae is the first papilla to get atrophied in any conditions like anemia, glossitis, is the filiform papilla. The most papilla to get keratinized in any, only the first papilla to get atrophied in any condition like anemia and glossitis, it is the filiform papilla. The most vascular papilla, the papilla which is having the highest blood supply, it is the fungiform papilla. Now the taste sensations, what are there on the tongue? It is the bitter, sour, sweet, salty, and the umami, which is the glutamic acid taste. All right, so with this on tongue, I am stopping this video. Up till the next points I'll be discussing in the part 3 of this video. And students and viewers, if you still have any queries or comments and who are new to my channel, subscribe and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Students, if you have any queries or comments, or if there are any videos what you want that I should be, what topics you want to be discussed by me, you're most welcome to comment me in the comment section. If you like this video, give this video a thumbs up. And this videos is mainly I'm focusing upon the one-liners MCQ, what are very frequently asked in the NEET PG MDS entrance exams. So students, if you like this video, give this video a thumbs up and share amongst your friends. Thank you for watching.